Hey guys, this is Dr. Webster. I'm here to talk about what to expect when you get braces on. Besides having a whole bunch of cool moving teeth and getting your teeth aligned, there are a couple of things to expect. Just on that note, your teeth are going to move and you're probably going to see some changes to your teeth pretty faster than you think. And the teeth are going to look really good. So the most times when people get their braces on, they feel a little bit of pressure. Braces involve two things, brackets, which are glued onto your teeth, and then the orthodontist puts a wire through the brackets, and that's what moves the teeth, the wire, when they are connected to the brackets. So depending on what kind of brackets your orthodontist use will depend on how much sensitivity somebody usually experiences. Usually the old school type have a little bit more of discomfort because they involve these things called bands, which are essentially rings that go around your teeth, especially the back molars. You may need spacers for those, which also usually don't feel too good. It's kind of like, it feels like there's a piece of chicken in between your teeth. I don't use those kind of braces, and so the ones I use are really low profile. They're really small. They have light forces. And so my patients, I rarely get any calls about any kind of discomfort or anything like that. We always call patients the day after just to see how they're doing, and usually they're getting used to kind of the feel of them. They are metal or clear, depending on which ones you get. The clear ones are made of ceramic material. But usually the cheeks need some time to kind of get used to the feel of having metal right by them. Sometimes they need a little bit of chance to adapt. Sometimes it will feel a little bit sore. The cheeks will feel a bit sore just because the braces are rubbing on them a little bit and they're not used to that. But that will go away. The cheeks will get used to it. Teeth, you'll feel a little bit of pressure on your teeth. It's nothing more than just having something push on them. Again, we use light forces, so it's not usually I don't get any kind of concern from my patients. And then you just have to watch what you eat, because now they're food traps. They will trap food. So stuff that is easily eaten, cut up your food so that you can easily swallow it. Anything like lettuce or bread or stuff that's going to catch on the braces will most likely get caught, in the metal braces. Not a big deal, but you just have to brush it off after you eat. I do recommend the hygiene is going to be a lot different when you get braces on. You're going to have to learn how to use the floss threader. It took me 15 minutes when I had braces on how to fully do it. That first night I was looking in the mirror trying to thread it through, and it was it's a learning curve. But if you do it every night, like I recommend, it gets easier and easier, and it'll get to the point where you can do it without looking in the mirror, and you can do it for less than a minute, the whole thing while you're watching TV. It becomes that easy, but you kind of have to pay your dues and learn how to do it. So some people ask me, well, do I have to floss? Can I just use a water pick? Water picks say that they're comparable to floss. I don't agree with that. I think floss can clean in between, down under your gums, better than water can. I use the water pick a little bit, but if you use the floss, then you don't need to use the water pick because you're cleaning everything out ideally. Water pick's definitely better than nothing, so a lot of patients will do that as a substitute, and again, it's better than not doing anything at all. And then I recommend, in addition to flossing, using a Listerine rinse for 2 minutes at night before you go to bed. Make sure it's in there for 2 minutes, sometimes because of the taste or because it kind of stings, because there's a little bit of inflammation. Patients will spit it out early. Go the whole 2 minutes, and as you do that every 2 minutes, it won't sting as much. The taste may still be there, but you'll probably get used to that, and then your gums will be a lot healthier. And so after flossing and using the Listerine rinse, I would definitely brush with an electric toothbrush for 3 minutes. Just go around. You don't have to brush really hard. You don't have to brush at all. Like the electronic toothbrush, the revolutions on it will generate the speed that it needs to do that. So anyway, that's a little bit what to expect. If you have any questions, leave me any questions. But yeah, it's braces are nothing to be afraid of. There's no needles or anything like that. It's a fun process. There is a little bit of, just getting used to the feel of them, and maybe a little bit of soreness. If you need ibuprofen every 4 to 6 hours, that's fine. But anyway, that's that. I'll catch you guys later on our next topic.